Okay, so what the hell does a chiropractic adjustment actually do? And I'm not talking the old school, silly chiro BS on which my profession was founded, but what does evidence-based practitioners like myself say it does? Let's find out. Okay, so chiropractic adjustments have a variety of physiological and what we call neurophysiological benefits, which is why it is a great tool. But guess what? It is not the whole tool, well, at least not how I choose to practice chiropractic, which is what I call performance chiropractic, or more like sports medicine based, evidence based, right? Which I'm huge on, which I'm sure you guys are sick of hearing what evidence based medicine or research or training or whatever it is because of the podcast between two dumbbells, but it's really important. But just real quickly, I need to clarify an adjustment does not, your bones don't magically go out of alignment and then I magically put them back in alignment. Okay. That doesn't happen. That's how the profession was founded, but we know that is no longer true. But what are these benefits that I said at the intro? Let's cover them real quickly. This is a 10,000 foot view, but this is everything you need to know about a chiropractic adjustment. What is chiropractic? So it improves joint function. It improves range of motion. It decreases pain signaling, sensitivity, and increases your threshold, which means you could possibly tolerate more pain than before the adjustment. It has a multitude of decreased inflammatory markers, which is pretty cool to see. It improves nerve function, improves reflexes, improves force output both locally and globally as a whole. It improves proprioception, which means your body now has a better idea of where that joint is in space and what it is doing. Yes, adjustments are a passive modality, right? But it is as close as what a passive modality could get to an active modality, aka exercise, that we possibly have. So it is a spectacular tool, but it is not the whole tool. And guess what? I don't adjust every single patient. I have never adjusted 20% of my patients, which is blasphemy as a chiropractor. About a third of patients will not let me adjust their neck. That's fine. Now, neck adjustments are perfectly safe so long as you rule out yellow and red flags. But if somebody's not comfortable with it, look, what I tell everybody, nothing is mandatory. I will give you what I think the best treatment option is, but you get the final say. So adjustments, they are awesome, but make sure you know what they're doing. Okay. And this is what the research says. This is not some outdated, silly BS that still gets repeated. Trust me, it drove me up the wall of having to take all my chiropractic philosophy courses and answer this nonsense on my national board exam. But guess what? I don't get to do that in office. I freaking love it. Before I was super headstrong in making sure patients knew that bone out of alignment or bone out of place boop is complete nonsense. Now, I really don't care what they think. Now, if they're going to ask me, then yes, especially if they came from fear-mongering, outdated chiropractor who the first thing they do when you walk in is x-ray you. That is a yellow flag. You run. I'll do a video on that later. But that's what adjustment does. Period. End of story. Now, my office is in the Houston Bay area. So Seabrook, Texas. I do telemedicine. Obviously, I can't do an adjustment over a video call. But if you're looking for a performance chiropractor, an evidence-based chiropractor, somebody who knows what the data says and what the data doesn't says and uses adjustments as part of a multifaceted process to where, yes, I don't want you relying on coming into me for adjustments 3 times a week. I refuse to see you 3 times a week unless you're literally flying in to work with me, right, to get over a certain condition. Hit me up, coastalperformancechiro.com, hit my bio link. And then if you want a telemedicine like consult and you don't live in Texas, go to the educatedmeathead.com.
Performance chiropractic and sports medicine in the Houston Bay area, telemedicine and nutrition coaching all over Texas. And if you're not in Texas, don't worry. You still do consults through the educatedmeathead.com, where you also find workout programs, seminar recordings, and online courses.